Well, hello and welcome to HealthLine this Tuesday evening. Thanks so much for joining us. I'm Jennifer Blomquist. I have the privilege of hosting tonight, and I'm so glad you joined us because we have not done a program for quite a while about Parkinson's. We're going to be talking about that, as well as something maybe you're familiar with, essential tremor. There are differences, and we have a neurologist with us tonight who's been kind enough to come back. He's been here before, but it's been a long time. So I bet there's somebody you know or care about, maybe a coworker or a loved one, who's dealt with this issue. And so I encourage you to call in. We are live in the studio, and our guest would be more than happy to answer questions, maybe steer you in the right direction for some help or types of treatment or therapy. So please call in at any time. We're going to be talking about the two issues, but we welcome your questions anytime. And there are a couple of ways you can do that. I know for all you faithful viewers who come every week, you know this, so I apologize if I'm boring you, but just want to make it sure everybody knows about this. Calling is the easiest way, 866-969-2720. It's a toll-free call. You'll talk to a call screener, and you can either ask the question live. They won't just throw you on the air, so they'll kind of talk you through it, and then you can ask it live. I really like that way because then you can talk to our guest. Maybe he would need to ask you some questions to be able to give you a better answer. So if you feel up to it, that's a great option. Or you can just relay your question to the call screener and we'll get it answered for you that way. Also, we started a texting option a few months ago. So that's a really easy way to get your question answered. Just shoot us a text. I promise your phone number will remain secret. We don't show it. We keep it private. If you feel up to it, though, maybe you want to tell us your first name and where you're calling from and then your question. So couple of options there. Let's go ahead and meet our guest tonight. Again, it's been quite a few years. I know I've never had the privilege of hosting with him, but others have. This is Dr. Jody Neer, and you are a neurologist.
Yeah, Jennifer, thanks for having me.
I appreciate you
coming. It has been a number of years since I've been on set to present, and I like the live offering, at least.
Yeah.
So as a neurologist, I've been working for, it's hard to believe, 25 years.
Wow.
And
yeah.
so
I bet a lot has changed over the course of your career.
Has changed, yeah. We'll talk about some of that in the area of tremor tonight.
All right. Well, you know, for most of us who don't deal with this specialty in medicine, you know, if we see somebody shaky, you know, or trembling, you know, we just probably assume they have Parkinson's disease. But there are differences between it's Parkinson's and essential tremor.
Yeah.
Why is it important to differentiate? Are there totally different treatments for them?
Absolutely.
Okay.
I think, you know, the clinical course is much different between the two conditions. I try to think of the tremor as mostly an internal idle, like your heart rate is for your heart, the brain idle. You don't normally feel that, but there are some people that kind of spill over and start to have tremors all the time, or they're brought on by certain things. And so we are often presented a patient who is concerned that they have a tremor and it's affecting their quality of life, and they don't know whether it represents something more serious that's going to progressively get worse, like Parkinson's disease, or if it is something more annoying, we'd call it, but life-affecting, called essential tremor. You
know, does essential tremor ever become Parkinson's in advanced stages?
Yeah, so the classic teaching was no, you know. Yeah. Over time, though, I do think there's a slightly higher risk. It may be from us closely following patients over time, but in general, people shouldn't be worried if they have a tremor that they automatically have Parkinson's disease. You know, that number is almost 8 to 1, meaning essential tremor is that much more common than tremor of Parkinson's. And again, tremor of Parkinson's is just one of many symptoms on that list.
You were kind enough to put together some graphics for
Sure.
us, and I want to make sure we take advantage of that because there's a lot more to it than you realize. So can we bring up the first graphic, which deals with just the different vocabulary
Absolutely.
about tremor. So there are different kinds of tremors,
Absolutely.
which I didn't know that.
Yeah. So we kind of think about what position the tremor is occurring in, right?
Okay.
So the so-called, when your hands are doing nothing, resting tremor. You're not using a muscle, they're just resting in your lap or along your side. That is a more indicative tremor of Parkinson's disease, and I'm sure we've all seen that in the community. Someone's hand is shaking as they walk down the hallway, that kind of thing. It's more of a out of sight, out of mind. A lot of those patients don't even realize it, that it's happening. And so that resting component is an important thing that we look for. The second thing is when our hands are put out in front of us in posture, we're holding that position for a period of time, and we will start to see an oscillation. Usually it's very fast and it's very fine. It's not a slow kind of flopping tremor. And then the third thing, most important, is the action component. So as someone is grabbing something or bringing it to their mouth, for example, or writing, I think we have some examples we'll show here shortly.
Yeah, we do. The handwriting examples are interesting.
That is more indicative of a central tremor. So postural tremor, hands in front, and then finger to nose or eating, drinking is more typical of a central tremor.
Can we bring up, if you guys don't mind, that graphic number 2 does, there it is with the handwriting examples. So on the left, that's essential tremor.
Correct.
How describe to me like the key components you look for to determine that.
And I think this example is a little bit too smooth as far as the undulations go. I kind of refer to this as Halloween handwriting.
Yeah.
You know, where you can see the jagged, someone may be writing a check at the grocery store or at the bank, and the nerves of that, really maybe people aren't nervous, but subconsciously they are, and so the tremor will pick up a bit. So with every aspect of that turn that we see there, the shaking is part of it, as opposed to what we have to the right side there with Parkinson's disease. The handwriting is really not tremulous, but it's small.
Yeah, it is.
And someone will take a very long time to draw in one little tiny spot. So just an example, and some people will bring these things into us and say, you know, here's my writing, you know, here's my checks. The bank won't cash them anymore.
Oh, yeah.
So.
You know, and that's interesting you say that when you think about somebody writing, would both hands tremble, you know, have the tremor at the same time? Or do you ever run across somebody who maybe they're right-handed, left hand doesn't tremor as much, so maybe they can kind of guide the hand. I don't know if that's feasible. Excellent
point. You know, I forgot to touch on that earlier, but Parkinson's disease is often unilateral with that resting tremor, whereas the central tremor is usually bilateral. And so you will see patients trying to hold a clipboard and trying to write at the same time is very difficult. But yeah, one side may be more prominent than the other. And I think that is because of their dominant hand. They notice it more. Oftentimes we refer to that as central tremor as kind of a peas on the fork, soup spoon, you know, or drinking from a glass. You know, putting a screwdriver on the screw head can be very difficult. Oh, I would imagine. That would be frustrating too, especially because neurologically they may be functioning just fine and able to, you know, cognitively, you know, function, but just, you know, to have that, you know, deal with that. Do they ever feel exhaustion from it? I've never asked anybody. Do you feel tired from your, you know, hands or body trembling? Absolutely. You know, they are often fatigued from the rhythmic movement. Sometimes this is a very large tremor of the head, the voice, and of the extremities. So it's just overwhelming, you know, and annoying. People will often avoid going out to restaurants. I can understand that. You know, oftentimes I think of this like a salad bar, you know, carrying a soup and a salad or whatnot. Not going to happen. You're not going to make it back to the table. And you know, we were talking before the show, and you've been in this profession for, you know, more than 2 decades. I think there's greater awareness of it. I was telling him, you know, all right, I'm really revealing a lot about my age, but I had a major crush on Michael J. Fox when I was in middle school and high school, and I never missed any of his movies or weekly television programs, and I just thought he was the coolest guy. And then I think he brought a lot of attention to this issue. I was blessed. There was nobody in my family who had that at the time, so I never really gave it much thought. But when he was diagnosed with it, and I remember seeing him testifying before members of Congress in Washington, just trying to draw attention to it and for programs to be created to help people. And so, you know, whether you love Hollywood or don't, you know, you got to at least give him credit for
bringing light to it.
Absolutely.
Because everybody in America knows who he is, I would think.
I think he's had a huge impact. The Michael J. Fox Foundation, as a non-for-profit, has been amazing to bring forward research, right?
Sure.
But also awareness and fitness. You know, is a big movement right now that helps patients with Parkinson's disease. You know, just the point I want to stress is that Parkinson's is not just a tremor. In fact, the tremor may be the most obvious symptom to the public, but it's not the most disabling symptom. You know, it really is slow movements, eventually balance difficulty, and then muscle stiffness.
All right. Well, we have a lot more that we want to talk about. We have some more slides to share with everybody, but we welcome your questions at any time. We would love that. So please feel free to interrupt at any moment. Again, that's why we keep the phone number and the texting number up at the bottom of the screen. So it's 969-2720. That's the phone number to call. Put an 866 in front of there in case you're outside of Fort Wayne. It will still be a free call for you. And then texting. I'm surprised we usually get a lot of people texting for the programs because it's so easy. That's a little different number, 969-2730. And again, we only have Dr. Neer here until a little before 8, so take advantage of the time sooner rather than later. What can a person expect, you know, if they're starting to have issues and they're concerned, you know, is this an essential tremor or is it Parkinson's? What should they do? Is there kind of a standard test that they can go through for a diagnosis?
Yeah. I think a lot of people will start mentioning it to their primary care provider. I think that's a good place to start.
Yeah.
Most providers are very familiar with tremor and at least how to kind of guide people. And so I think that's very helpful. A lot of times they will even start a treatment, you know, that may, in anticipation of sending a patient to neurology for further evaluation. But I'll be honest, you know, the primary care in our region is very good, and a lot of times patients have tried 1 or 2 medications without much benefit or side effects, and they're ready to come in and hear about, you know, what else could be done.
When you say medications, and I know the approach across the board in all specialties is start conservatively. So are you talking about maybe just like an oral medication, and is it to help control the movement, or is it more like neurological functioning, or?
Yeah, great question. I think just maybe take a step back in regards to adaptive techniques. You mentioned holding the hand down. Many people will change the way they write, or holding that hand tight, or
kind of
changing the way
adapt.
that they grip a pen. They make weighted pens or weighted utensils. They have a kind of a fancy gyroscope you can hold so that the fork doesn't move. So, you know, humans are innovative. You know, they come up with ways of making this livable. And so there are those conservative ways, and then oftentimes we do kind of spill over into medication options.
All right, well, I want to talk more about that, but somebody did call in. Fred called in, wanted me to ask the question for him, so thank you, Fred. So he wanted to know if elevated levels of iron can cause tremors. That's interesting.
Yeah, that's a great question, Fred. I'm not sure that we would typically consider elevated iron levels as a cause of tremor necessarily. There are many different types of tremors beyond what we're talking about tonight that can be induced by chemical, right, at least. Other medications, right?
Sure.
And so I even use caffeine as an example, right? Caffeine will give us sometimes a little bit of a stimulant effect with tremors. So, but I'm not aware that iron itself would be something you could, we would test for to see if it's elevated.
Yeah, do they do blood work? I know you've got a whole clinical. In fact, we've got a slide. I think is it number 3 or no? I think it might be further down or further up. Excuse me, where you talk about different ways to diagnose it. Is there? Does blood work give you any clues? I wasn't sure.
Yeah, when it comes to kind of laboratory studies, there are really just a couple of things that we think about. Thyroid, right?
Oh, sure.
Hyperthyroid, overactive thyroid, kind of is like a thermostat. We turn it up, we get tremulous, we get tachycardia, we lose weight, you know. So we check thyroid, and vitamin B12 level is a common test that's done. So pretty simple. When it comes to genetic evaluations, there's really not a lot in the essential tremor group. There are some things in the Parkinson's territory with regards to genetic testing.
All right, yeah, I didn't think about that, that you could have that hereditary component.
Sure.
What about environmental factors? Do those, you think, ever play a role, or are researchers even considering that as a factor?
Clearly. I think I always kind of tout the VA has done a very good job of collecting data on the veterans and where they've served and what they may have been exposed to and owning up to that. And so even some of the Agent Orange or the Camp Lejeune water, or things like that, they've tried to make links, and a lot of those conditions are neurologic. Tremor being a common one, Parkinson's being another. And so clearly there's an environmental trigger from a Parkinson's standpoint, but essential tremor tends to be 50% genetic or 50% random.
Okay, all right. Yeah, that is, I mean, it's great that there's research, which I know we want to talk about that toward the end of the program as well. But we did get a text message, so thank you so much. Rita called or texted from Fort Wayne. Her question was if Parkinson's disease eventually results in death, can it shorten your lifespan?
Yeah, you know, I spend a lot of time with patients in the clinic trying to provide guidance on this, and clearly it's hard to predict the future, but typically for, I call it garden variety Parkinson's disease that behaves well, it shouldn't necessarily shorten someone's life. It will make it more difficult. Yeah. By far. Risk of falling, you know, the risk of choking and aspirating, those are real risks. But if I always tell them, if we do our job right and you do your job right by exercising, I think we can take this a long way. And I was just wondering if a lot of people can live independently, you know, with this. I mean, especially if it's somebody older, maybe their spouse is no longer living or they just live by themselves. Is that safe or only up to maybe a certain point? Yeah, I think speaking of Parkinson's specifically, the progression of that, really we think of 5 stages. You know, stage 1 and 2 are mostly tremor and imbalance, and that can take years, 7 to 10 years maybe to move through a stage. Stage 3 is having a little bit of balance issues, maybe needing some help every now and then. 4 and 5 really lean heavily on a walker and someone being there. So it really comes down to following these patients over time and trying to predict, you know, where they're heading. In the meantime, they're exercising every day. Yes. If they do it, right? Yeah, hopefully. They're exercising in groups, right? Which is hugely helpful. That's really good, yeah. And so I think that's been some of the major movement has been the patient's initiative to take it on. And we are blessed to have a wonderful medical community and a lot of amazing nonprofit organizations. And there is a nonprofit in town that we've done programs with them before, Turnstone, and they have a great exercise program for Parkinson's patients. And I've learned a little bit about it over the years. And so it not only helps them physically, but as you were talking about, Dr. Neer, the importance of socializing, because these people, you know, will go to this exercise class together, and they all, you know, are dealing with similar issues, which I think would be very helpful and avoid isolation. Absolutely. You know, I think that the spouse is encouraged to come to that. Yeah. The patients are working out, and it's not easy. They look kind of tough, actually. If you see video of them doing some of these exercises, and as you were saying, we were talking before the show, it's kind of symbolic because it's like kind of like kickboxing. Absolutely, you know? Yeah. So it works on balance and voice, right, and speed of movements. You know, some of the early trials of movement helping Parkinson's were with cycling. So pedaling, RPMs, I think. The more RPMs, boxing, the RPMs. Yeah. Walking is good, right? It doesn't push every button that you need to work on per se, but it's better than nothing. No, I mean, anything you can do to get out and about and just try and, you know, make your life, quality of life, you know, is such a big thing. So they just held up the card not too long ago that we're getting down probably about
down to the last 5 minutes, believe it or not.
Okay.
So we could still take a few questions.
Okay.
So we thank you to Fred, thank you to Rita for sending us some questions. But if you're out there and you want something answered, even if it's just to get a frame of reference, if you think maybe somebody has an issue, what to do, please just let us know, and Dr. Neer would be happy to address that for you. So. Once a person is diagnosed, what kinds of options do they have? Do you do any intervention necessarily for essential tremor?
Yeah.
Right off the bat?
Right off the bat, it's nice to review what medicines people may have taken,
okay.
What testing, if any, they've had, how concerned they are about another condition, at least, and then it's really thinking about, are there medication ways? There's only one medication that's FDA approved to treat tremor.
Oh, okay.
We try a lot of things, and basically, we think of kind of taking the edge off of the nervous system a little bit. People don't want to be confused. They don't want to be tired, right? They don't want to have other side effects, and so it's a real hard balance. When we extinguish the medication options, there are kind of some next level treatments that have been around for a while now.
Yeah.
Even you referred back to Michael J. Fox's Parkinson's at least, but
yeah.
There's ways of kind of manipulating the brain, if you will, injuring a small area of the brain that's in this complicated circuit. Deep brain stimulation has been around for a very long time, putting electrodes into the brain, stimulating, a little bit like a pacemaker. And then over the last 10 years already, we've had non-invasive treatment with focused ultrasound.
And, another thing we were talking about earlier is I think people in Fort Wayne, and hopefully this is, hopefully people are opening their eyes to see we have so much here medically available. There's a lot of stuff that you can have done here and not have to go to, some of the bigger cities, which that's difficult, especially if you're talking about an older person, trying to travel, have somebody get them there, going a few hours away. I know I hate having to do that with my children, and so I can only imagine for, somebody older, that's a burden. So you were saying they have a lot of options here. I mean, why not try it? It can't hurt.
Absolutely. And yeah, having these offerings in the region is very nice.
Yes.
Because all of these treatments were academic at one point, just like a lot of medical advancements, and then eventually they filtered to the regional centers, and eventually to even smaller communities sometimes.
Yeah, no, that's great to know. So we want to talk about research too. We just have a few minutes left, but we've talked about just the issue coming to light nationally. Is it a big topic of research? Do you feel like there's a lot of advancement? Yeah.
I think in the essential tremor, right, essential tremor is the most common movement disorder.
Yeah.
It affects people. It's not life-ending or it's life-changing, though.
Sure.
They have researched 30-plus medications, most of which fail because of the side effects, right? Trying to take the edge off of the nervous system is difficult. And so the research is heavily weighted right now into procedural interventions. I think the circuit of this tremor control, making our movement smooth, there's multiple steps. And I think eventually we may find that treating one aspect of the circuit helps someone more than another person.
Yeah, it definitely sounds like it's not a cookie cutter, diagnosis for each person is unique.
Yeah,
what it sounds
very
like.
Much so.
I don't want to put you under the gun. We only have 2 minutes left,
okay.
But we did get a text from a man named Mark. He wanted to know if there were any links between Parkinson's and Alzheimer's.
Great question.
And we hear a lot about that now.
Absolutely. So both of these conditions are neurodegenerative, right?
Yeah.
One is a movement disorder, the other one is a cognitive disorder. And we really don't know why these two areas, multiple areas of the brain decide to close up shop before we're ready, at least. And so patients with Parkinson's disease can develop dementia. It's usually later in their course, 10 years, 15 years, 20 years down the road. Patients with Alzheimer's disease don't usually have movement problems early on. As things advance, their movement system may fail them. But there really isn't a link. I think sometimes we'll find patients that were diagnosed with both Alzheimer's and Parkinson's disease, and the neurologist in me would say, no, that's probably something we call dementia with Lewy body disease, which is the second most common dementia after Alzheimer's. Most people haven't heard of it before.
Yeah, and these are all things that they continue to impact a lot of people. Like, growing up, there was no, if you had said a memory care center, I would have said, what? We have memory care centers all over now. I mean, and I've written some articles about them, and they do them, they design them. I mean, they work with the contractors when they're building them based on the symptoms. And, like I remember one of them, they said they like to walk in circles.
For sure.
So they just had this whole thing was based around like a hallway where they could walk in circles. And so again, there's so many advancements being made. So I hope that all of you out there are dealing with it or know somebody who has this will take heart in that things are getting better and we have more available, certainly compared to years ago. So the time is up, Dr. Neer.
Oh, wow.
I apologize. It goes fast.
It definitely
yes.
goes fast.
Again, Dr. Jody Neer, neurologist.
Yeah, thank you.
Thank you so much.
You
Great
bet.
to have you on. Thank you, everybody. Have a good night. Take care. We'll see you next Tuesday. Bye-bye.
The preceding program on PBS Fort Wayne is made possible in part by
all the small things.